So,
And can they come in for like stitches, stuff like that?
yeah,
So you're not going to the ER? Like
absolutely.
if you cut yourself at 10 o'clock at night, you have a choice. I'm going to go to the ER and pay a ton of money, or I'm going to wait tomorrow morning and see Kelly. Like, is that an option? Can you wait that long?
Yeah, so it's interesting. Medically, you can't wait that long.
Yeah.
I could see you, but we can't probably put stitches in. There's like a
Right.
certain number of hours that after that point, if you close the wound, it'll get infected. And
Right.
so, we know all that stuff. But what you could do is call us and
Yeah.
say, hey, I have this injury. We're on call for you.
Right.
Is this something I can see you for in the morning? And if not, where should I go? And then we can help direct you to the most cost-effective, most appropriate care level. Sometimes that is the ER.
Welcome to the On the Move with Matt podcast, where we sit down with local businesses and highlight what makes Winchester and the surrounding area so special. Whether you already live here, you're considering a move, or you just want to plan a visit, my goal is to help you discover everything this community has to offer. What's going on, guys, and welcome to another episode of On the Move with Matt. Today I'm here with Kelly Botta, and she is the owner of Smartypants Medicine. So thanks for coming on today.
Thanks for having me, Matt.
Yeah, you're welcome. And let's just get it started by, what is Smartypants Medicine?
Smartypants Medicine is a direct primary care practice, and so we see ages 16 and up, and we provide medical care. We just do it through a different way than the traditional model. So we'll get into that.
And are you a doctor or a nurse practitioner
I'm actually a PA,
or a PA?
yeah, a physician assistant, and went to school here, Shenandoah University, graduated almost 15 years ago, and I just started this practice about 5 years ago.
Okay.
Yeah.
And so before that, were you working in like at Valley Health or somewhere like that?
Yeah, so my work history, I have a lot of different experiences, but largely I worked for a large private practice down south a little bit in internal medicine, which is adult medicine. And so I've done that the bulk of my career. I did work here in the ER for 2 years, and I was their first female PA. So they have a big thriving program now. So that's
Oh,
kind
wow.
of fun to look back on. And then back to primary care. I love primary care and just getting to know people over years and years and the trajectory of their health. So that's what I did before this.
And do you guys have like a physical location that people come to, an office, or do you go to their house?
Yeah, we do. So last time we talked, actually, it's so fun to be back on here because
Yeah.
you were the first interview I did when I started the business, and we
wow.
were a house call only practice at that time. And I do still make house calls, and that's probably about 25% of who I see now.
Okay.
But last year we had such a demand that I couldn't house call for as many people as were interested. And so we got a location here in town in Winchester, and I was able to hire another PA, and here we are.
And are you guys just like rapidly growing right now, or is it pretty crazy?
It's going really well. Yeah, we're excited.
And do you think people prefer to come in the office, or like when you go to their house, do they like that? It's kind of
Yeah,
old
so
school.
it's been really interesting. People love house calling. It's like the ultimate concierge medicine,
Right.
the ultimate convenience. And so we still offer that. It's a little bit more expensive, and so that
Right.
some people choose to come to the office just to save the money. What they love the most is that they have access to me and our other PA, and so they can text with us directly.
Oh,
We answer same day or next day, email, phone calls, texting. So it's really quick access, which is unique in healthcare. It's not very speedy.
Right.
We have a hurry up and wait kind of mentality in healthcare, and so this practice is very different from that. So people were unsure at first, but when they came to the office, I actually designed it to feel like a living room or to feel like a home. I have to work there too, and so I
Right,
want it to
yeah.
feel comfortable, and
Yeah.
nice. And so we do not have a traditional waiting room. There's couches there. It's dark colors. It's set up like a living room. And then we also set up our consult spaces so that they're not just an exam room.
Right.
So we meet in nice armchairs in a
Yeah.
nice office and just chat. And then, of course, we have the exam rooms for all the medical stuff. But it's
Yeah.
a really different vibe, and it's very slowed down care.
Right.
And so in a way, it's been neat to see people come from the house call side into the office and say, this is so much better than what I thought. It's awesome in here.
Right,
It feels
yeah.
it doesn't feel doctor office-y,
Yeah.
And so to me, that's a compliment because that's exactly what I was going for.
And do you have to have like a membership, or do you take insurance? How does that work?
Yeah. So that's exactly what direct primary care is. So you get direct access to us, and the payment model is just different, excuse me, from traditional healthcare. So it's a low-cost monthly membership.
Okay.
And I describe it to people, it's like Netflix for healthcare. And
Right.
so instead of going to the movie store back in the 90s and you had to drive all over the place to try and find this DVD, and then, Netflix disrupted that entire industry, and it's
Right.
this low cost and you can order it anytime you want. It's basically what we're doing with healthcare. And so
Yeah.
it's a low cost monthly membership. We're on call all the time. They have access to us, and it's just a much more convenient way to get your medical care.
And do you and the other PA, do you kind of take off like you work this weekend, I work this weekend? How does that
call.
work?
Yeah, I was terrified about call.
Yeah.
In fact, I almost didn't start this practice because of it. But once I spoke with some other owners, they reassured me. Most people are very, very respectful of your time. They realize we have a family, and
Right.
after hours and stuff. So we're just really clear up front on guidelines. And so the after hours use and weekends use are for urgent and emergent things.
Yep.
And people have been awesome with that. We have the best patients. They've been
Right.
super respectful. And, Colleen and I try and be really open about our lives too. We're just individuals in the community, and we have families. And so they know that. And so
Yeah.
I think there's this really neat dynamic between us, and it hasn't been an issue. So we all take our own call.
And do you have like a secretary that greets the patients and all that?
Yes.
How many employees do you have?
Yeah, so we have 2 admin assistants that work with us to kind of help with some of the scheduling stuff.
Right.
And it's like it's a fancy concierge style office. So you come in and it's by appointment only. You can't just walk in. We don't see anyone off the street,
Right.
know.
Yeah.
And so it's a locked entrance. You have to buzz in to get in, and it's been really fun.
And clients, you said they're texting you. Are they texting your personal number?
Yeah, they
Or do you
get our
have-
personal number.
Oh, wow.
Yep.
And how's that going? Is it,
Fine.
it's not overwhelming or anything? People aren't texting you at like
So-
12 o'clock at night?
No, like I said, we're pretty good about setting up guidelines for that. And
Yeah.
because we're so available and people learn that we will actually text them back or contact them back same day or next day, they're not having to like kind of panic about something small. They know
Right.
that if they call tomorrow, they're going to get us.
Right.
And so we haven't had any issue with that. If we do, there's some coaching that goes on at the beginning if they're
Yeah.
not using the service correctly, but it hasn't really been an issue.
And you said 16 and up, right?
Correct.
Okay.
Yeah.
So if a family comes in and they have, 3 kids, 6 and under or something like
Yes.
that, do they
Yes.
would you ever be open to, doing that kind
Seeing
of stuff?
kids. Yeah, we would love to have a pediatrician. We would love to have a pediatrician join the practice.
Yeah, now hiring.
There's a large demand for it actually.
Yeah.
And if you guys are from this area, you probably know the pediatricians are all full.
Yeah.
There's a lot of demand for pediatric care. There's a lot of demand for medical care in general. There's almost nobody taking patients in Winchester anymore. If they are, the wait's over 6 months.
Oh, wow.
So our access to care here is very poor because we're growing so fast and there's just not enough providers.
Right.
So yeah, we would love to take kids. Colleen and I have been in our whole careers in internal medicine, which is adult medicine. And so we're not going to slide over to that. At this point, we want to bring someone who's specialized at that. So a nurse practitioner or a PA or physician who's doing that. But we have some really good partnerships with the other practices in town. And so they're able to take care of the kiddos. The nice thing about peds too is they have night clinics oftentimes
Right.
and weekend clinics. And so that's different than for adults. For adults, your normal practice doesn't usually have that.
Right. Yeah.
Typically you have to go to urgent care, or to the ER. Whereas in pediatrics, they're set up a little bit differently for that.
And if you're a PA, is it like a law that you can't see kids?
No.
Okay. So you have to have a completely different degree for that?
No, we don't. We can see anybody. Yeah, and we
Yeah.
can actually, the nice thing about being a PA, just zoom out from a professional standpoint, one of the reasons I picked to become a PA instead of go to med school is because it gives you the opportunity. We're trained as generalists, and so we can actually switch specialty anytime we want to without going back to school. And so we kind of there's an onboarding process if you do a specialty, so you get
Right.
some training on the job. But in general, we're not kind of pigeonholed into our one specialty the way the physicians are. And so for my personality, that was really appealing.
Right. Yeah.
As it ends up, I love what I'm doing, so it wouldn't have probably much mattered. I landed in an internal medicine office. But yeah, if we wanted to go do cardiology, we could. If we moved and needed a job in dermatology, we could do that without
wow.
having to go back to school. And so that's one of the advantages of the profession.
And how is becoming an entrepreneur? Because now you're a PA and you own your own business.
Yeah.
I'm sure there's been some headaches.
Oh man, it's been a wild ride. I grew up in a family my dad was an entrepreneur, and he owned his own small business, and so I kind of knew there's like no days off in entrepreneur world.
Yeah.
You're the buck stops with you. But I think I got to a point in my career. I did get to a point in my career where I was either walking away from medicine, and I wasn't going to practice anymore at all,
Right.
or this was another way to still practice medicine, but have it be a little more sustainable for
Right.
my family and the life I wanted.
Yep.
And so that meant entrepreneurship,
Yeah.
you know? And so I was familiar with that. I knew what it was. And if I didn't have a supportive spouse, there's absolutely no way this would have been possible.
Right. Yeah.
Because there's quite the ramp up, you know, when you're doing something new to the area and just brand new to me.
Right.
So it's been a pretty big learning curve, but my husband, Jeff Botta, he's a PT in the area. He's been absolutely amazing and supportive and actually encouraged me to do this. He's like, you should just start one.
Right.
So I just wanted to work for somebody, you know, and
Yeah.
he's like, we don't have one, just start one.
Right.
And so we figured out if we could make it happen. And here we are. It's gone way better than expected. It's grown into something I never really envisioned. Excuse me. And now at this stage of the practice, I don't know if I want to talk about this later, but I've learned a lot on the business side of healthcare. And I feel like I'm positioned so much better than when I was working in a traditional setting because I understand the industry.
Right.
And we're kind of shielded from that as medical providers. We kind of know how to diagnose and treat. We know how to take care of our patients, but we don't necessarily know all the billing, all the business stuff, all the contracting, and all the behind the scenes stuff. And so I've learned a lot of that. Both before I took this jump, I started doing some administrative stuff before I took this jump, but then a lot on my own. And so now I've been able to use that to help other small businesses. And so outside of just community members, we've now been partnering with some small and large businesses to try and help them control their healthcare costs. And that has become really exciting work.
Right.
The medicine now is like, I've been doing that for a long time. That part is easy.
Yeah.
And the entrepreneurship and business side has just been so fun to explore and learn and see all the opportunity there is to help in that way.
Right. Because, when you own a small business, that's one of your biggest headaches is getting health care for your employees.
Yes.
Because unless you're like some massive corporation, then it's very expensive.
Exactly. The prices are astronomical. And in fact, some of the data shows near double-digit increases for employers year over year.
Oh, wow.
That's an insane statistic.
Right, yeah.
And so for these business owners to have to budget for almost double-digit increase
Right.
year over year for all of their staff is just nuts.
Right.
And so, but that is kind of what healthcare has become because of the insurance industry, health insurance industry, and it always being tied to employers.
Right.
And that's fairly new. That started back in the 60s or 70s. So that's not been around that long,
Right, yeah.
but it's kind of morphed into this really expensive system in the United States. And so ultimately, that's making the cost of everybody's goods go up. It's making the employees' wages go down because so much of their profit is going towards health insurance.
Yeah.
And so direct primary care, this was not my idea. This is a model that's taking off across the country.
Right.
And because it's like a all-inclusive model, so one thing we didn't talk about with the membership is we don't bill you every time we see you. So it's not like you don't pay a copay every time you come. You pay your flat rate and you see us as much as you need to. And so how that works out is some months you might not see us at all. Some months you're sick, we might see you 3 times.
Right.
But kind of the cost averages out over the year. And so that works out for us and the patients. They can budget for their health care.
Right.
It's good for us as business owners. We can predict our finances, right? And it actually keeps the cost of their care really low. And so the employers are able to partner with us to help get some of their healthcare costs down. And that's something I didn't even know existed 5 years ago. So.
And can they come in for like stitches, stuff like that?
Yeah.
So you're not going to the ER? Like
Absolutely.
If you cut yourself at 10 o'clock at night, you have a choice. I'm going to go to the ER and pay a ton of money, or I'm going to wait tomorrow morning and see Kelly. Like, is that an option? Can you wait that long?
Yeah, so it's interesting. Medically, you can't wait that long.
Yeah.
I could see you, but we can't probably put stitches in. There's like
Right.
a certain number of hours that after that point, if you close the wound, it'll get infected.
Right.
And so, we know all that stuff. But what you could do is call us and say, hey, I have this injury. We're on call for you.
Right.
Is this something I can see you for in the morning? And if not, where should I go? And then we can help direct you to the most cost-effective, most appropriate care level. Sometimes that is the ER. Sometimes we'll say, actually, you can wait and see us in the morning, right? Maybe not for that, but maybe for, say, really severe side pain that we think is a kidney stone.
Right, yeah.
And so we can help navigate or triage. We call that triaging. How severe is this? How urgent is this? And where do you need to go? And so that saves people a ton of money. In fact, yesterday, I thought coming in here today was a really interesting day because I had somebody injure themselves with a mandolin, this like kitchen device that you shave things, like shave vegetables with.
Yeah.
Called me and I saw them within an hour. you
Oh,
know,
wow.
and took care of that, saved them, you know, fingers bleed like crazy. So
Yeah.
saved them an urgent care ER visit.
Yeah.
And then that same day I did a procedure where we injected their knee, someone with bad arthritis.
Oh, wow.
And so keeping people, the stuff we can do in primary care that's not really complicated, that they don't need to be seeing a specialist for,
Right.
it frees up the specialist schedule to see the more severe stuff and do what they're good at.
Right.
That improves everybody's access when they really need it, and it keeps
Yeah.
our patients taken care of quickly at a low cost. And so it's really a win-win for everybody. We just got to have the time to do it.
Right.
And so now we do have that time to do it. We're not pushing 25 people through a day.
Right.
Yeah.
And can you just keep adding patients, or are you going to get to a point where you're like, okay, we need another PA?
Yeah, that's the goal.
Yeah.
So my panel is full right now, so I'm not taking new patients. And our other PA, she's got some space left on her panel right now. But yeah, the idea is there's a lot of providers who are looking for a way out of the system. You know, they're feeling burned out. You'll hear that word a lot. And
Yeah.
since COVID, but we really, in the traditional medical system, we have to see a really high volume of patients, and
Right.
it's very, very demanding,
Right.
emotionally, mentally, physically. And so people are burning out of the industry. And so people are looking for another option, which is what happened to me. And I
Right.
was looking for another option. And so now
Yeah.
I've created that option for our community. So yeah, we're happy to grow. This model's taking off across the country. People experience this level of care and they
Yeah.
just don't go back.
Right.
Yeah.
And you said, so I mean, it's not a franchise, it's not your model,
No.
but Smartypants Medicine,
That's
you
mine.
came up with that. That's yours.
Yeah. Yep.
So are there other like unique names and people are kind of doing the direct primary care?
Yes. So pretty much across the country, this is all independent providers wanting to go back to kind of old school medicine,
Right. Yeah.
where it's really just us and the patients, and there's no infringement from a third party payer saying what we can and cannot do
Right.
for our patients.
Right.
Because originally that's the way it was. Everything was cash based. We were paid like a lawyer was paid or like an accountant was
Right.
paid, right? And then it kind of got tied up into, during the war, actually, they were looking for a way, they had a freeze on salaries. And so they were looking for a way to retain employees, and they started paying for their healthcare benefits. And that's kind of how this whole thing started.
Right.
But yeah, now it's gotten a bit out of hand. So
Yeah.
this is just another way. Direct primary care is almost all independently owned providers looking to provide the type of care they went to school to provide, which is not rushed.
Right. Yeah.
It's totally patient focused.
Yeah.
And it's been amazing, actually.
And
So,
do you find that most of your patients still carry health insurance?
yeah,
Because
that's a great question.
something crazy could happen, and you,
Exactly. So we always tell them, yes, please keep your health insurance, or if you don't have any, go get it.
Yeah.
You know, and so because we can't help you if you get in a car accident and you break your leg, you know,
Right,
you've
yeah.
got to get to the hospital for that. And so again, because of the expense of our healthcare system, that could bankrupt you know, and so if
Yeah.
that's an option, if people can get insurance, that's always catastrophic coverage is really
Right.
what we're recommending
Right,
for the
yeah.
big serious stuff: heart attack, cancer diagnosis, stroke, hospitalization from an accident, a trauma,
right.
really high level care. The kind of stuff that we do in primary care is actually not that expensive. And so a really cool partnership that about 75% of our patients have is they have a high deductible health insurance plan plus us.
Right. Yeah.
And so, right, so they might have a $5,000 deductible. So if you get strep throat and you have to go, you're going to basically pay out of pocket for that anyways, because you're under your $6,000, right?
Right. Yeah.
And so with us, instead of paying $350 and going to the urgent care for that, you know, they can see us, and our monthly fee, that would cover them for like 3 to 4 months
Yeah,
of
and
care.
You already know what the fee is going to be every
You
month.
already know.
Yeah.
Yeah. And that's 4 months of care for them,
Right.
full time, anytime they want. And so we also include a bunch of testing. So we include strep testing, we include urine testing, flu testing, we do EKGs, we do skin biopsies, all the stuff's included. You don't get
Right.
dinged extra for all of that, you know?
Right.
So we're not trying to profit on all these extra things. And so we really do want to provide affordable care for the community. And this is a way to do it, and it works. It's very exciting.
Right.
So it's just a different paradigm that people have to kind of get used to. Healthcare is a pretty boring topic.
Right.
Nobody really wants to learn about it or talk about it, but we all need it.
We need to know.
We
about
need it.
Yeah.
And so this is just a cost-effective way to get your primary care. So yeah, a perfect pairing is a catastrophic plan or health insurance of some type, plus our practice.
Hey, it's Matt Kilmer. Yes, the guy you're listening to right now. When I'm not sitting down with local business owners and sharing their stories, I'm helping people buy and sell homes right here in Winchester, Frederick County, and even across state lines into West Virginia. For me, real estate isn't just about transactions. It's about finding the right fit for your life. Whether you're upgrading, downsizing, or even buying your very first home, I'm here to guide you every step of the way. From showings to negotiations, you'll never be left wondering what's next. If you're thinking about making a move, pause this episode, send me a quick message, and let's make your next move the right one. All right, let's get back to the episode.
Yeah, because I mean, kind of like you said, like a lot of people they're going to go to the doctor, and you're going to give them your insurance card, and then the insurance decides whether they're going to cover that or not.
Correct.
And then if they don't cover it, I guess you
get the balance.
Yeah, it's like, okay, you're going to be strapped for this fee.
That's right.
Yeah.
And the troubling thing that everybody feels about healthcare is it's one of the only industries where they don't tell you the price up front. Like, what other industry has that? It's insane.
Yeah.
And so direct primary care makes us as providers feel ethically and morally a lot better about the care we're providing, because we can say, I'm going to order you this test and this is how much it costs. Is that something you can do? Right. Yeah. And if it's not, is there a way around it? Is this an emergency? Is this urgent? Is this something you need to finance because this is really important we get it done?
Right.
Or is this something that we can wait 3 months while you get your paychecks built up and we can go do it then?
Right.
And so we can have these conversations that we're educated to keep out of the exam room, actually.
Right.
Because we don't know anything about the cost in the traditional model. 5 people with 5 different insurances get the same test, they're going to get 5 different bills. It shouldn't be like that. Right, it doesn't need to be like that. Yeah. We all know the cost of that test is one thing, and so this is the way the financial incentives in the healthcare industry have become misaligned. And we believe that we should be putting patients over profit. And this is a way that we can still work as a company and we can still make, a living, but we cannot be bankrupting Americans while we take care of them. Right. And so that feels really good as a provider.
And
one more thing on that. I learned a startling statistic in this process that 40% of the country is in medical debt. Yeah. And I was so upset, Matt. I was shocked.
Right. Yeah.
I was a part of this industry for 10 years. I never heard that statistic.
Right.
Like, we are shielded from it, and we're ordering tests because we are doing what's right for the patient, and the system around us is just not really built to help people out. Right. On the financial side. Yeah. And so this has just been awesome because I don't have to compromise the level of care I'm providing, but we can also do this in an ethically upstanding way where people have transparency on pricing. Right. And the whole industry needs disrupted and transparent pricing. We should be able to do that.
Right. Yeah.
Yeah. It's not rocket science.
Yeah.
And so we're really excited to be offering that, at least in the primary care space.
And are you partnering with like other local companies and stuff like that, other businesses?
Yeah.
And trying to get all their employees memberships?
Yeah. So we currently, if you go on our website, we have all the employers that have come to understand the benefits of direct primary care. And many of them are, these are forward-thinking business owners and businesses who are wanting to do preventative care for their employees.
Right.
We all know in America, we don't do a great job at preventing disease. Right. We spend the most and we are not the most healthy. When you look at the world statistics, we are not actually even close.
Yeah.
We're not even close to the top. And so we're not very good at prevention. And so what we're trying to do as a practice is become the most preventatively minded practice in town.
Right.
And that means we do things differently. We screen a little bit differently. We check some other things. We have conversations that we don't have time to have in the traditional setting.
Right.
We talk about diet, we talk about stress, we talk about sleep, we talk about hormones, we talk about supplements, we talk about all the things.
Yeah.
Right. And building healthy habits. And we have time to do that. And so when we partner with employers, they know that their people are getting these conversations that are improving their quality of life. They're improving their health. What's that going to translate to for the employer? It works out for them too.
Right.
Data shows healthier people, happier people do better work. They don't miss work.
Right.
So then their production stays up, right?
Yeah.
So not only is it they feel good about providing a good benefit for their employees, that all these owners, they want to take care of their people.
Right. Yeah.
It's just they're priced out. They can't afford to take care of their people the way they want to because of the healthcare industry.
Yeah.
And so they want to do this. And so we've come in as a solution to partner with them to make that possible. And so it's good for their business, but it's good for their bottom line. And it's super good for their employees who are actually getting healthy.
Right.
So yeah, we've had some pretty impressive stories of, people who haven't had care in 10 years, coming in, getting their labs done, us finding stuff that should have been addressed years ago,
Right,
but
yeah.
they've just not sought care because of the expense.
Yeah.
And being able to fix those things, and from mental health to thyroid disease to diabetes to heart issues. I mean, all these things that
Right.
we've caught just because we come in for a screening exam.
Right.
It's nuts.
Yeah.
But there's a big drop off, I think, when you hit like 25 to 50, 25 to 45,
Right.
where
Yeah.
like you just don't go get care at all
If it's not
unless
broke,
you're
don't fix it.
partially dying. I mean,
Yeah.
you just don't
Yeah.
go. And so we have to work on changing that paradigm if we want to change the outcomes of health in our country.
Yeah.
We've got to change that paradigm where we don't think about our health unless we're half dead. We've got to start being proactive and paying attention to what our numbers are, and
Yeah.
thinking about what we're doing from a movement standpoint and a nutrition standpoint. And we want to have those conversations and help change the paradigm.
Yeah, because I'm sure a lot of people don't go to the doctor, like you said, the expense, or, 25, 35, 45, they might be like, well, I feel fine, so I must
Right.
be fine.
Right.
But you really need to go to the doctor and get screened. And
Yes.
I guess you can show people, well, actually, your blood work shows this. And if we take care of it now, it won't be a problem later.
Exactly. And we could also say, like, hey, this isn't a problem yet, but if we don't change X, Y, and Z based on what you told me with your habits, in 10 years, you're going to probably have X, Y, and Z. So why don't we pivot a little bit,
Right.
and then we can kind of coach them through that, because, again, we're not getting paid based on how many times we chat with you.
Right.
And
yeah.
so we can set up any type of a follow-up that works for your health. So it's really all about the patient, the client, whatever you want to call them. Obviously, in our setting, we call them patients, but whatever avenue they need to get to their healthiest self, whether
Right.
that's checking in weekly, monthly, or every 6 months, we can help them build that plan.
Right.
So it's been really fun.
Yeah.
Yeah.
And you said you're teaming up with a local gym. Can you share some of that?
Sure. Yeah. So we are partnering with, this is a new initiative that we're doing, actually. And it's been something that I've had on my mind for over a year. And hopefully, if all things go well, this fall we're going to launch. And I haven't announced this to our practice yet, but we are doing a thing called the Smart Card, which is a membership perks card. And so it's something that we're providing as a value to all of our members.
Right.
And we are partnering with local health and wellness businesses. And they're going to provide a discount or a benefit to our patients to put on this card. And then our patients hopefully are going to be encouraged to use their services, right?
Yeah.
Because we want to keep supporting local. We want private practices to continue to exist.
Right. Yeah.
And we want our patients to be healthy. And if we can take some of the financial pain away from them doing these services. So we're ranging and including things from farmers markets, chiropractic care, aesthetics, gyms, kind of the whole gamut, massage therapists.
right.
So that's what we're working on now. And we hope to continue to build out those partnerships, over the next couple of years, because our health matters and spending money on it is important.
Right.
And we
yeah.
put our money, where we put our treasure. Those are the things that are important to us. And we should be valuing our health, because you never realize
Right.
how valuable it is till you don't have it.
Yeah.
So, yeah, that's what we're up to. And so I'm really excited. We've got several businesses, and that'll all be coming out in the fall. But it's been really fun to connect with other owners.
And do you
Support
go
what
around
they're
and like
doing.
educate businesses and stuff like that, or their employees?
On our direct primary care practice?
Yeah.
Yeah, so usually I end up meeting somebody in the company that gets me into either the owner or the HR benefits person.
Right. Yeah.
And so if anybody is interested in this that's listening, if you want to reach out to us, we typically have a consultation conversation that's just me and that person. So I can kind of
Right.
explain, I can learn, one, what they need.
right.
And if we're not it, we've been here a long time. I've been
Right,
I've been
yeah.
living here like 20 years. So we can connect them to the right person in the community to help solve their healthcare issue. And if they are looking for what we offer, then we can kind of take next steps with them and explain what we do. And the more we can support small businesses,
Right.
the better.
Yep.
And for them to retain top talent, they need to provide benefits. And while we are not a traditional healthcare benefit, let's be clear about that. We are not health insurance.
Right. Yeah.
We are a first stop, right?
right.
And so this can help their patients, their employees, stay healthy, get their medications refilled. Some people, they're running out of medicines. They don't have health insurance. They don't want to go. They're not taking their medicine. They're coming off that. And it creates all these downstream problems. They're not showing up at work.
Right.
It's
yeah.
like, guys, this isn't that complicated. We can
Yeah.
solve this for like under $1,000 a year.
Right, yeah.
This is not expensive stuff.
Right.
And so, yeah, it's been super exciting to be able to say that we have something that's real world that can help these employers right now.
right.
That can
yeah.
help their employees right now. and it's not complicated.
Right.
You know, they don't have to navigate the health insurance market.
Yeah.
So yeah, obviously, like we talked about, we recommend that they get some type of an insurance if they can. But like the truth is, a lot of people cannot afford it,
Right.
and they're walking around with nothing. No coverage, no primary care, no preventative care. They have no idea what their blood counts are. They have no idea what their lipid panels are. They don't know. And so we believe that knowledge is power, and we want to make it affordable. And I'm so proud of what we're doing.
And can you offer your patients like discounts on medicines, or do they just use GoodRx?
Matt, you're so good at this. Yeah, yeah, we do as much as we can. Like I said, we're trying to add value to our patients. And so one of the things that we do is we contract with a local lab to get reduced pricing. Okay. And this was another thing that totally blew my mind was the cost, the actual cost of lab work. Yeah. Right. It's like any test in healthcare. It's going to be marked up some, right? You have administrative overhead, you have, some costs that you have to cover, but testing is marked up like often 10 times what it costs. And so we're able to really, with our contract pricing, reduce a lot of that. And then we can offer, it's a self-pay option that our members get. And it's only for our members. Okay. And so then they have the choice, because we have transparent pricing. Right. Yeah. They have the choice whether they want to self-pay for these things, and we can tell them the cost, or whether they want to run it through their insurance. Say they have preventative benefits. They can still use that. Our orders still work, And say we order an x-ray. We can tell them what that x-ray is going to cost if they self-pay. Right. Or they can choose to use their insurance if they're lucky enough to have that. Right. Yeah. But that's up to the patient, and they should have that choice. They're given good information. They can make a good decision. Right. But if they're not given that information, you don't even get a chance. Yeah. Right. And so it's been a lot of fun.
Yeah. Because a lot of times, you go to the doctor or the dentist or whatever, and you're in the chair. They're like, oh, we need to do this x-ray and this x-ray. And you have no idea what it's going to cost. That's right. You're just like, okay.
I guess I need it.
If I need it.
I guess I need it.
If I need it, let's go with it. And then you're just like waiting 2 months for that bill in the mail.
Yes.
And then you're like, oh, wow.
Yeah. We call that surprise billing.
Yeah. Not fun.
We do not believe in surprise billing. It's the only industry that does this, and it's insane, and it's bankrupting people. And they would make better decisions if we gave them better information. Right. And so I just encourage people to educate themselves. This is an option that's out here. I'm happy, we do free consult calls if people want to. So like, what about my situation? Could it work for me? I have this going on. And so we do calls, 10 to 15 minute calls, Colleen and I, to answer those questions. We're not trying to, be unethical and getting people to sign up for a membership. There's no long-term contract. It's month to month. Right. We want it to be a good fit for them. We want them to come to our practice and never leave, because it's the best care they've ever had, and we're earning their business. Right. And so we want to be transparent with that. So we have those consult calls up front, and no surprise billing, no copays. Yeah. We always tell you, say you have something additional add-on, like say you want a B12 injection. You have a low B12 and you need a B12 injection. Okay. So we don't charge you for the administration fee or anything like that. You're going to have to pay for the medicine, either get it at the pharmacy or we'll order it for you and you can pay for it. Right. But we'll tell you it's going to cost this much. Yeah. Is that something you could do? How do you want to do this? Do you want to use your insurance? Do you want to self-pay for it? And it's been a really neat way to practice medicine. I've learned a lot.
And do you have like a 5-year plan, 10-year plan, or vision?
Yeah, I have a vision.
Yeah.
I don't know if I say my vision out loud. Yeah. You know what? We're hoping to grow. I think, like I said earlier, there's a ton of providers who are at risk of just quitting. And that's not helpful to our community. Right. We have less healers. We have less providers. We have less helpers. We do not want people leaving healthcare right now. Right. Yeah. We have an aging population. We have a growing population. Yeah. We need more helpers. There's been a primary care shortage for 15 years. Right. We don't need more people exiting. Yeah. So what we need to do is create alternative ways that are more sustainable, that people like direct primary care. So I'm hoping to bring on more providers. That may mean more locations. I'm hoping to help more small businesses. Right. That may mean more locations. So it's been really fun, and I think there's a lot of opportunity in the future, and hopefully it's a win-win for everybody.
And what is the cost per month? Does it vary?
It does, yeah. So on the website, we believe in transparent pricing. It's all on there. Right. It's age-based. It's not based on how sick you are or how many times you use the practice. Right. And so the cost ranges from $85 to $105 for in the office. Okay. And for house calls, it's $125 a month. Okay. And for employers, we do discount that cost. So.
Right. So, very affordable.
Very affordable. Like I said, it's about $1,000. It's concierge medicine essentially. The only difference is we do not bill insurance plus bill our patients.
Right. Yeah.
We just bill our patients and we leave insurance out of it.
Yeah.
And it makes everyone's life a lot more simple.
And I'm sure like every business goes through the pain. They don't want to increase their prices, but you might get to that point.
Yeah.
Especially
We've
in like
had
the
to
restaurant business and stuff like that. I mean, you have to make money.
You have to, when the cost of goods is going up, right? There's nothing you could do really.
Right.
So I'm sure at some point prices will increase. We've only increased prices once in 5 years. So I think we're doing pretty good.
Yeah.
But like I said, we're not trying to make 10x profit, you know?
Right. Yeah.
We're just earning a normal wage, trying to provide value to the community, trying to make healthcare more sustainable, more affordable, more convenient.
Right.
You
Yeah.
know, and provide another option for healthcare professionals who need a way out.
And I got to ask you, how did you come up with his name, Smartypants Medicine?
Yeah.
It's definitely catchy.
Yeah. So that was part of it. I didn't want to be a simple name like everybody else here.
Right. Yeah.
Because what I'm doing is simply so disruptive that wouldn't even make sense to be named the same thing.
Right,
So I
yeah.
intentionally wanted a disruptive name, which Smartypants Medicine definitely is. People double take all the time. They repeat the name on the phone all the time. But when I learned about this, there's two reasons. When I learned about this, I didn't think it was real, this model of care.
Right. Yeah.
It was the smartest way to pay for healthcare I had ever heard of.
Right.
And to the point I really didn't think it was either legal or real.
Right.
But it's both of those things.
Yeah.
And so I was smart, and I was trying to come up with a name for smart. And then my kids are the main reason I left traditional medicine, because I was burned out and I didn't have a lot of time. And I call my kids little smarty pants, little smarty pants. And I've said that since training in PA school. It's just kind of one of the words I use, I guess, in my vocabulary. And so it just felt organic to me. And our service is really personal. And so I want my energy to come through for that. I like to tell our staff, we take your health really seriously, but we don't take ourselves too seriously.
Right. Yeah.
And so we want that energy. We want those out of the box thinkers who are willing to challenge the status quo and do things differently and get better outcomes. So that's kind of where the name came from.
And do people like that it's not like a sterile environment? You come in, it's comfortable. Have people told you they love that?
Love it, yes. Everybody's first comment is, this is not what I was expecting. I love it.
Yeah.
Yeah, which is so encouraging to hear, because that's exactly the kind of space we wanted to create in our community. So it's very inviting. It's warm. It's not a sterile feel. Of course, the exam rooms, they got to feel a little sterile because sometimes they have to be.
You have to be sterile.
But most of the time, most of the visit is 90% of the time we spend just hanging out talking. And the truth is, most of our skill as clinicians is listening, asking the right questions so that we can arrive at a correct diagnosis or solution. And so we simply have time.
Right.
That's the big differentiator. Right now we have 30 to 60 minutes if we need that. Sometimes it's quick in and out. It's a rash, you're in and out, you know.
Yeah.
But 30 to 60 minutes, we're talking about your blood pressure. We're talking about your weight. We're trying to get you to quit smoking. We're trying to, like, big goals, you know. These are complex. You got heart disease. You got a lot of stuff going on, kidney failure. We need time.
Right.
And so our visits are 30 to 60 minutes long. We can listen.
Yeah.
We can figure out the root cause of what's going on.
Right.
Sometimes it's the medicines they're on. Like, actually, that's a side effect of this medicine you're on. Have you ever tried coming off of that before?
Yeah.
And that ends up working, but we have to slow down enough to listen to our patients and have time to use our critical thinking skills that we learned in school.
Right.
And so unfortunately, oftentimes, no fault of the providers, but just in the traditional healthcare setting, the way the model is set up, we're forced to move really fast. And we try and collect as much information as we can, as fast as we can, to make the best decision as we can. Our intention is still there, but we simply don't have the time that we need oftentimes. And so this model has been amazing for that.
Right.
And I really feel proud of us for being able to help some of these patients who feel stuck. They feel like they're not heard. They feel like they've seen 4 specialists. They're all telling them different things. They don't know what's going on. They don't know what to do. They don't have any more money or time to spend on this. They've been sick for a year and a half.
Right.
And so if we can just sit down with them for 1 hour and help them solve that, I mean, the reward level for us as clinicians is like off the charts.
Right.
You know, so if we maybe don't take as much money, but we love our job and we love what we're doing, like, it's 100% all day, every day, we're going to say yes to that.
Right. Yeah.
And so I think this model just really aligns with what the patients want and what we want to give. And it just it makes a business model that fits both of those needs.
Do you think this model would ever go to like specialists?
Yeah,
Like where
it has.
for like surgery and stuff like
It
that?
has, yeah.
Oh wow.
So there are rheumatologists, orthopedic surgeons, cardiologists, peds, just that I know of.
Right, yeah.
I don't know if there's any neurologist. I don't think there's any neurologist yet in Virginia. But yeah, this model works for the outpatient care. And so I think it's a cost containment strategy for the system at large. We're still at the front end of like the growth of this. So I think as we have more and more people doing it and we're able to pull the data more, we'll be able to, kind of see how much impact it might have at the system level. But right now it's been totally organic growth, but it's absolutely effective. And we know they have some preliminary data that they've done on direct primary care practices across the country.
Yeah.
And we know that we have improved access, which just means you can get care when you need it. You
Right.
call up and you're not having to wait 3 weeks, right?
Right,
So
yeah.
you can get in when you need to get in. So if your access is good, you're going to be healthier. So you have less disease, and the severity of your disease is less, and your cost is less. And so when we're talking about, macro level changes for the U.S. healthcare system, that kind of stuff's really important because that's a money saving measure, which is going to lower the cost of healthcare without compromising the quality. In fact, I would argue strongly it improves the quality. And people are less sick. They're having less disease.
Yeah.
And so there's been some really, really cool data, double-digit decreases in ER visits, like to the tune of 20-25% when we're looking at like a company data, right, of all these people that they can pull the data on. Decreased when they work with a direct primary care practice, 25% less ER visits, which is nuts. Double-digit decreases in inpatient stays. So you're getting admitted to the hospital less. Why?
Right.
Because we're seeing you earlier. You have your disease better managed, and you're not having all these acute flare-ups and complications. And so the data is out there. It's just a matter of the public becoming educated and the paradigm shift of how we pay for our healthcare and people being open to that.
Yeah, because
So that's
like
exciting.
costs for surgeries and stuff like that. Like if you see some surgeries 30,000, 40,000, 50,000, it's like how are they possibly this much? That is insane.
Yes.
So if that model could go to that,
Yes.
yeah, then people would be, because some people are probably walking around with, they need a knee replacement or hip replacement and they just can't afford it.
Yep. And it's that plus it's all the hidden fees. It's the anesthesia that comes with the surgery.
Yeah.
It's the rehab that comes after the surgery. It's the pre-op testing, and then they find you have something wrong with your heart, and you got to go through this $15,000 workup before you can even get your knee, right? And so there's a lot of peripheral cost that people don't know that they're going to be signing up for. So yeah, I think there's a ton of potential. There are definitely orthopedic surgeons, spine surgeons doing this in our state.
Oh, wow.
Yeah, and so I think, the future is definitely bright, and it's a good thing. It's a good thing, really, for the insurers, and it's a good thing for the patients. And so hopefully it's going to help be the solution, part of the solution in healthcare. It's a very complex problem. It's not going to solve everything.
Right, yeah.
But it can solve a lot in primary care. It can solve a lot for patients who are totally uninsured and going uncovered.
Right.
No screening. It can solve a lot for these small businesses that don't have anything to offer. It can solve a lot for people who don't feel that they're heard because they're getting rushed, or they've got 6 things going on because they've got complex medical problems and they have 7 minutes to talk.
Right, yeah.
And so there's certain patients where it's a difference maker. So there's a seat at the table for everybody. Traditional primary care, not at all to diminish the work that they're doing. They're working super hard. They're doing a great job. There's simply so many people and so much need, and we're understaffed with providers. And so they're doing their best to keep their head above water. But the fact of the matter is they're burning out.
Right.
And people also are not getting well.
Yeah.
And so we have to do something different.
And now that you don't have a boss anymore, you're the boss.
Yeah.
What do you do when you have questions? Do you have like a mentor?
Yeah. So there's a really neat direct primary care community that's all these independent people who are all really risking their careers, risking their families' finances. Like we have very nice, spelled out benefits when we stay in the traditional model, right?
Yeah.
And so we're sacrificing all of that and risking it to do what we feel like is right for us and for the patients. And so that takes a pretty specific and brave, if you will, type of person to try. And so there's been a pretty neat community of DPC owners across the country, largely online, which is crazy.
Right. Yeah.
But yeah, we all network, and so we can share resources. What are you doing for sleep studies? Where are you finding,
Right. Yeah.
these monitors or whatever. And so I've learned a lot that way. Super grateful. There's been some local in the state of Virginia practices that I've talked with when I was opening. There's no procedure manual for this. It's a new industry.
Yeah.
And so called the medical boards, called the pharmacy board, talked to all the boards, trying to figure it out. And so now I'm able to help some of the people that are coming behind me. We're the first PA-owned practice in Virginia.
Oh, wow.
And so I didn't even know we could do this, but there's a way to do it. And I hope that it inspires some other people to see a need in their community and go after it.
Right.
Yeah.
And are there like guidelines for Virginia on what you can and cannot do as a PA? And
and that's the same stuff that's always been there.
Right. Yeah.
But it doesn't really affect how we practice or what we call our scope of practice at all.
Right.
That's the medicine.
Right.
There's always this is where the guidelines are, and you got to stay within that. Doesn't matter what setting you're in. This is your lane. Stay in your lane.
Yeah.
And so that stuff hasn't changed at all. But state to state, there are some differences just in the profession broadly.
Right.
Being a direct primary care practice doesn't change any of that.
Okay.
As a PA, yeah.
Perfect. Well, thanks for coming on today. We really appreciate it. We've definitely learned a lot.
Yeah, thanks for hanging with me through the boring topic of healthcare. Obviously, I'm a nerd and I'm excited about it.
Yeah.
But I hope it opens some people's thinking and it creates a new solution, and that people can get ahead of illness and stay healthier.
Yep.
And we're happy to chat with them if they're interested in that. And I super, super appreciate you having me on a second time.
Yeah, no problem.
Yeah, it was really generous of you.
If they want to sign up, what's the best way to do that? Should they call you, go to the website?
Yeah, the website's the best way. And so there's a link, smartypantsmedicine.com, and there's a link on there that says sign up. You can just click on that. It's like a 5-minute enrollment. It's really easy. There's also a form there if you want to schedule a call, like an interest call.
Okay.
That's free, and they can fill that out. We have our administrative team. They'll get in contact with them usually within 24 hours.
Perfect. Thanks for coming on. Appreciate it.
Thank you so much for having us.
You're welcome.
All right.